Let's talk about diabetic weight loss medications. These are your GLP-1s, and the generic names for them are semaglutide or tirzepatide, or they come in the name brand forms of Ozempic, Wegovy, Mounjaro, Zepbound, Saxenda. These are still getting all of the hype, mainly because it's very effective for weight loss. The problem is that a lot of insurance companies are not covering it for weight loss because it is not FDA approved as a weight loss medication. So typically people can get it more often approved having diabetes than they can for weight loss. I am seeing these a lot more often in the gastroenterology world, and I have patients that are frequently coming in and asking if they can be put on these medications. These medications do have a lot of downstream benefits, so things like reducing cholesterol, controlling blood glucose, likelihood of improving fatty liver. So usually because of the weight loss, it can also improve the amount of fatty liver infiltration. There are some things that you need to know about them though. So one of the big things is that they work by slowing down the peristalsis or contraction of the stomach, which causes some slow gastric emptying or gastroparesis. This is actually one of the benefits for weight loss because it gives the feeling of fullness and early satiety, so that you won't want to eat more. The problem with this is it can cause a lot of nausea and vomiting, and it's not that you can't take these medications, but you need to know how to manage that. So because these medications are likely to slow down motility of the stomach, you can take away some of the side effects of the nausea and vomiting by changing the way that you eat. So smaller, more frequent meals, like 6 to 8 times per day, avoiding things that are super fibrous and hard to break down. So fruits, vegetables, they need to be cooked really well and not have any skin on them. Also, if you're eating meats, you want to make sure they're very finely chopped. Raw vegetables are typically really hard to manage on a medication like this. Other things to watch for with these medications is it can make you more at risk for pancreatitis and also gallstones. So if you start having pain up in your right upper abdomen, that is definitely something that you want to get checked out right away. These medications have been great for diabetes and for people who want to lose weight that have tried a lot of other methods. The important thing is to know how it affects your body, and also how you can help side effects. The other thing is you still do want to do lifestyle modifications like diet and exercise with this.